I'm excited to be here with you all today. My name's Laura Burgess. I'm a solution consultant. I've been at Athena for 11 years, and my job is to help you all visualize athenaOne workflows. Our goal is to tackle the most common questions from those considering a switch to athenaOne. We do have a robust suite of tools available to support your needs. Given our tight schedule, we won't be able to take live questions, but please submit any you have, and we'll ensure they are shared with your sales executives, who will follow up to arrange a more in-depth, customized demo for your team as soon as possible. Please also note that we won't be covering dental services in this session, but we will showcase what we can within the limited time we have. Again, we'll make sure your contact follows up to address specifics in a one-on-one demonstration or discussion. So with that, let's go ahead and get started first with a demonstration of the athenaOne mobile app. All right. So the athenaOne mobile app supports the full clinical provider workflow. As a provider on the athenaOne mobile app, I can log in with my fingerprint or with facial recognition, and that'll bring me to my homepage. In my homepage, I do have my inbox where I can manage my tasks, such as incoming lab or imaging reports, or even manage patient cases. And I can even initiate a phone call right from my iPad to contact the patient, and I can do so while hiding my phone number. I can also view my schedule to see patients who are ready for me. I can use voice for navigation. I can view an entire patient chart, place orders for prescriptions, labs, referrals. I can document a patient visit using dictation, text macros, templates, and save findings. Another method of documenting in the mobile app is using ambient notes. I'm going to play a provider, and I'll invite Tim Kelly to be my patient. All right, Tim. So when I go into the exam room, all I need to do is click on Start Ambient. And then I'd want to make sure I get consent to let the patient know that this visit will be recorded. All right, Tim, you ready to get started?
I am indeed.
Hello, Tim. It's good to see you again. How's your family?
You're doing good, thanks. No complaints.
What can I help you with today?
Well, I have this rash on my arm, and it's been bothering me for a few days now.
Have you noticed any changes in the rash over time?
Yeah, it started as a like a small patch, but it's spread and become more inflamed. I've been applying this over-the-counter hydrocortisone cream, but it doesn't seem to be doing much.
Does the rash itch or cause any discomfort?
Yeah, it's quite itchy and sometimes stings a little too.
Have you used any new soaps or lotions, or have you been exposed to anything new or unusual?
Don't think I've been exposed to anything new. I've been using the same soap and lotion that I always do, but now that you ask, I'm thinking about it a little more. I was hiking last weekend, and I may have come in contact with something.
Okay, that may be it. How have you been feeling otherwise? Has your asthma been under good control?
Well, after the hike, I did have to use my inhaler more than usual, but it seems to be getting better now. It's okay.
All right, so I'll have you roll up your sleeves. Let's go ahead and take a look at your rash here. Let's see. So it's red. It's a raised rash on the medial aspect of the right forearm, approximately 10 by 5 centimeters, without any drainage. The rash appears to be localized to the right arm. And let me listen to your lungs. Take a few deep breaths for me. Right? So Your lungs sound clear. I don't hear any wheezes. Air movement is good. And based on the appearance and symptoms of the rash, it's likely a contact dermatitis. Sometimes even small changes in products or exposure to certain plants or chemicals can trigger an allergic reaction. I'm going to prescribe a topical cream to help alleviate the itching and inflammation. Additionally, I recommend avoiding any potential irritants or allergens that may have caused the rash.
Wow, thank you, doctor. Is there anything else I should be aware of?
Yes, please apply the cream as directed and keep the affected area clean and dry. If the rash doesn't improve within a week or if it worsens, please schedule a follow-up appointment. It's important to monitor any changes.
Understood. Thank you for your help, doctor.
You're welcome. If you have any further questions or concerns, don't hesitate to reach out. Take care, and I hope you feel better soon.
Thanks so much.
All right, so I can use this pause button in the center if I had to step out of the room or if I were interrupted for some reason. But you'll see I'll also have the option to exit and resume later or preview the summary. I'll go ahead and send the summary to the chart now. This will just take a few seconds. So ambient notes can help clinicians to easily record patient visit conversations, automate visit note generation, and seamlessly place the visit note into the patient encounter. The use of ambient listening and generative AI is going to really simplify clinical note documentation and improve the visit experience for clinicians and patients. This will just take a few more seconds and then our note will generate. We have the reason for visit note that populated, as well as our HPI note that populated, all based on the conversation that Tim and I had. There is the option to edit this if I needed to make any adjustments or maybe add some additional information. I have my review of systems that populate all the descriptions from the interaction with Tim. Now, in addition to the ambient listening, I can still also use some of my document accelerators like save findings, some text macros, and templates. These documentation accelerators are also available on the desktop version. Now we'll see our assessment and plans does note the contact dermatitis as well as asthma as the diagnosis, although it won't populate the coded diagnosis or an actual order for today, but that is on our roadmap. So I want to still add the diagnosis or order from here. All right. So once I've added my diagnosis and I've added any orders that I wanted to send the patient home with today, I would go to my sign off and I can go ahead and review the encounter and close this encounter to move on to the next patient. So now that we've looked at the athenaOne mobile app for providers, let's take a quick look at the patient portal from the patient point of view. Bear with me just a moment here as I switch screens.
Hey, Laura.
Yes.
This is Tim. While you're doing that, a question came in. If you don't mind trying to multitask a little bit, there was a question that came in that said, "How are conversations?" So, like with the ambient tool, how are conversations like this going to actually capture all of the required questions to meet reporting measures?
That's a good question. So it really is honing in on the conversation between provider and patient, and with that, going to produce that encounter or that summary. Now there is some kind of things in the background that'll take place to make sure that it does capture those things, but we can definitely have a deeper conversation regarding that in a follow-up demonstration.
Excellent. Thank you.
Of course. All right. So we're going to take a quick look at the patient portal from the patient's point of view. The patient portal is a high quality patient experience tool that allows health centers to retain and attract a diverse range of patients. On the patient portal, patients have the convenience and flexibility to view their test results, manage their upcoming appointments, self-schedule or send appointment requests. They can prepare for these upcoming appointments by completing an online self-check-in ahead of the visit. The online self-check-in will walk the patient through a review of their demographics, their preferred pharmacy. They can sign forms digitally, pay any outstanding balances or copays. They can also complete screeners like the PHQ-2, the PHQ-9, or the Prepare screener. Patients also have the ability to send and receive secure messages. They have visibility into billing and can make payments or even initiate patient payment plans. They also have access to patient care summaries and patient education, all from the patient portal here. Now, patients can access this on a desktop computer or a laptop, but we also have Athena Patient, which is a mobile app version of the patient portal available for iPhones and Android. And we'd say patients are pretty happy about this app. We've had 800,000 total monthly active patients using the app, and 90% of patients left a 4 or 5-star review. So we've looked at the mobile app for providers, and we've just looked at the patient portal quickly for patients. Now let's look at athenaNet. So Athena is a cloud-based or an internet-based solution. And really what that means is real-time access to Athena whenever and wherever. The center panel on my home screen is my schedule or patient list. The right-hand side is the messaging board, and you'll see some training and resources here towards the bottom. We push out 3 major releases a year in spring, summer, and fall, plus continuously nightly updates as well. These updates are included at no cost and non-disruptive to your workflows. The left-hand side is my task list, and we also call this the workflow dashboard, which we'll talk about more here in a moment. I'm just using my laptop today, but you can access Athena again using a desktop computer, laptop, or tablet. Athena is permission-driven, so your role determines your homepage view and access. Now, in the essence of time, I've completed a patient visit, but I'm going to walk through my demo patient, Miss Judy Turner. Now, before we go to Judy's visit, let's first talk about or start with pre-visit management. Now, this is the care gap worklist. This page allows you to view and act on care gaps for patients with upcoming appointments. The care gaps here are identified by Athena supported quality programs such as HEDIS, MIPS quality, and clinical guidelines, as well as gaps identified by payers such as Anthem, Humana, and Optum. So a clinical staff member can use this list to identify patients with open care gaps who are coming to the office the next day, and that staff member can start to queue up orders to satisfy these care gaps and also add notes to the encounter. Or you may have a quality manager who may want to identify patients with upcoming appointments who require certain preventative care measures. These care gaps are going to correspond to the patient's quality tab in the patient's chart. Now what I'd like to do is move into the check-in stage of a patient's visit. So I'll go back to my patient's visit with Miss Judy Turner, and we'll take a look at the check-in stage from the front desk point of view. So Athena will send out appointment reminders via phone call, email, and text message, and even include live operators to assist with scheduling and rescheduling those appointments. On this check-in screen, we can see the patient's banner at the top holds The social determinants of health field or the FDOH field, these are customizable. Also on the check-in screen, the system will flag if there are any patients who do not have an insurance card image on file. We know how important this is for revenue cycle. It will also flag staff of any sliding scale programs that are about to, or plans that are about to expire, or that the patient may be eligible for. So all the data collected here at the check-in stage flows to the appropriate report. So it's the UDS report, and we'll take a look at that a bit later. But you'll also start to see some yellow fields or required fields. This is going to guide the staff on what information needs to be collected. As I'm moving down the check-in, you'll also see some patient portal registration statuses here. Now, you'll also see the financial fields indicating this patient's social determinants of health as well. Athena does have an automated insurance eligibility check that starts 3 days ahead of a visit, and on-demand eligibility check with payer-provided benefit details. We also do have a sliding fee schedule based on the poverty scale that's updated annually when released by the federal government and maintained by Athena. But you can also create your own custom sliding fee with flat rates or percentages or both. Now, if a patient is listed as cash pay or self-pay, we do have a coverage scan to help identify patients who may have Medicaid coverage and may not be aware of it. And then lastly here, we'll see patient responsibility that's displayed. So staff doesn't have to guess what they should be collecting in terms of an outstanding balance and a copay. And that's pretty much it. That's the check-in screen. So now that the check-in is complete, the patient goes to have a seat in the waiting room, and then the back office is notified that this patient is ready for triage. So I'll go back to my home screen here. And before we dive back into Judy's visit, I want to draw your attention to the left-hand side of the screen, which we're calling our clinical inbox. The clinical inbox is user-specific, so each user or staff member has their own inbox that they will manage. This is your task management, and it's also where you'll find incoming faxes. We call this document management or document services. So document services utilizes AI and machine learning to read and extract critical information from incoming faxes, ensuring accurate placement in the patient's chart. This is a significant reduction in document processing time, which allows providers to access important information faster, leading to improved efficiency. So AI is not new to Athena. We've been incorporating AI-enabled features into athenaOne since 2016, and we're committed to expanding its AI capabilities to better serve healthcare providers and improve patient outcomes. Going back to our patient visit with Judy Turner, let's take a look at that triage stage just quickly. So for the sake of time, I've completed most of this visit, but when we look at the intake stage, this would typically be done by the MA or the nurse. As the medical assistant or maybe as the nurse, I would have already captured this patient's reason for visit or chief complaint. I may have already captured the patient's vitals, maybe did some medication reconciliation, reviewed some of the past medical history and social history. These are super customizable and reportable. Let's take a look at this patient's chart. We also call this the briefing page. Again, I'd like to make mention to her social determinants of health banner at the top of our page, which indicates that this patient does have a food insecurity. I can also see that this food insecurity is listed as a problem in her problems list. Now, to the far left-hand side of our chart, we do have chart tabs. Let's take a look here at our medication list. So Athena Chart Sync is a feature that automatically consolidates and deduplicates external data, like the medication list, and then presents it in the right place at the right time. We would also look to connect with your vaccine registry so that we receive vaccine data and also push vaccine data into the registry. What we're also seeing here is a list of this patient's encounters. This would also include if they had any dental visits with athenaOne Dental. Additionally, I do see this patient's quality management tab. So based on this patient's demographics and the problems that are in her chart, it is flagging any clinical guidelines or measures that are coming due or any that may be past due. This corresponds to that care gap work list that we reviewed earlier, and this data is going to flow to the appropriate clinical quality program. Additionally, you'll see here this patient, you'll see the Apps tab. This Apps tab allows you to embed third-party apps right into the system, like the Find Health app. The left-hand side of our patient chart or briefing page shows the last visit this patient has had within your center, any recent activity, and then also outstanding orders. So as a provider, let's go ahead and take a look at the SOAP note. So here's the exam stage where I, as the provider, would document the SOAP note. I can document however I'd like to. So I can use dictation, so Athena dictation. I can use text macros. I can use templates. We have structured templates. We have text-based templates. I can copy forward from a previous visit. That's all customizable. Now, in the review tab, it does show me what my NA or nurse has completed so far. So I can see the patient's care plan and see kind of where they stand in that care program. I also can see some of the patient's vitals that were captured by my medical assistant or nurse, as well as that blood glucose level as well. And then that prepare document, right? What did the patient complete there so far? So really, I can document the SOAP note however I'd like. These are just examples of what has already been documented. I do have this patient's physical exam, again, which I've already documented, and I've used a structured template to document this. This patient did complain of a red irritated skin tag that she wanted to have removed today. So we went ahead and took care of that for her. I could have also used Athena Capture to capture an image of that skin tag prior to removing it. We'll take a look at the assessment and plan. Again, most of this I've already prepared for us, but in the assessment and plan, Athena does have an enhanced diagnosis picker powered by IMO. So I can go ahead and add that diagnosis and add the order. The more that I use Athena, it starts to learn my ordering habits and my diagnosis habits, and it'll start to queue up suggestions for me. We do support HCC coding and really to focus providers on recapture rates and not missing a diagnosis. As part of this patient's plan today, unfortunately, Judy Turner's hyperlipidemia is not improving. So I'll go ahead and add a quick text macro to this assessment note. We'll also go ahead and prescribe her some simvastatin, and we can see how the system starts to suggest that medication just based on the diagnosis I'm on. With that prescription, that'll go to her preferred pharmacy. It also gives me access to Epocrates as well. Now, if this patient, so there's my Epocrates there for this prescription going to her pharmacy, and based on her insurance, also would typically show me a price estimate there for her. Maybe we also did need to renew her Linsinopro, so I'll go ahead and do that now. Here's my refill or renewal button for Linsinopro, and that adds it right to the appropriate diagnosis. That's my Lisinopril. I also note that we do have a diabetic ophthalmology referral going out for her. We do have referral coordination tools to help manage this. And then we do have a referral out to a case manager or coordinator to assist with her food insecurity. Now, when I'm ready, I would indicate when I expect to see this patient back. Judy will be back in sometime in July for a Medicare annual wellness visit, but I'd also like her to return in about 3 months to follow up with me. This information is going to flow to the checkout desk, so as Judy is checking out or leaving today, the checkout staff knows exactly how and when to schedule her next appointment. If for whatever reason she doesn't schedule this appointment as she's leaving today, Athena will send her an automated reminder to remind her. I'd move on into my sign-off page, which shows you a nice summary of today's visit. Athena will generate the patient care summary and any consult letters for care coordination. On the billing tab, I'll see what codes have auto-populated. So we have our ICD-10 codes. Here's where I would normally plug in my level of visit. I do have my other codes that have auto-populated. So we have the skin tag removal. Also make note of the CPT2 codes that has also pre-populated here to close quality gaps with payers. I'll go ahead and save this for now and say that this patient can be checked out, or I can sign off and close my encounter. And from here, we'll move on to the billing workflow. So when we look at this billing workflow, I want to take us to the workflow dashboard. Now, the workflow dashboard is the heartbeat of your revenue cycle. This page is showing us by department or by center or by location. And it really does show claims-related tasks. So you can think about claims that need to be created, claims that require your attention or review. It's also going to show you any claims that Athena would be working on your behalf. Let's go ahead and create an claim so we can walk through that example here. So I have my patient here. She has a claim that's ready to be created. All of the information here is submitted, so I'll go ahead and create the claim from here. Now, when you create the claim in Athena, it'll run through our proprietary billing engine to proactively catch anything that could potentially cause a rejection or a denial. In real time, the system will provide feedback and guidance on next steps. What I'm showing here is that when we submit claims based on, we'll go ahead and submit claims based on formatting. So the claim will split for wrap billing. And once the claim is split, you'll have the visibility into the sibling claim. So it'll tell you what it's doing or show you what it's doing currently. Right now, it's just applying those billing rule logic. It just takes a few seconds here. And then it's going to let us know if there's anything that Athena has identified, or if there's anything that was required, like the wrap billing for splitting the claim. So we're able to see that here. We'll also see a note of it towards the bottom here. In this example, the claim split in order to accommodate extra diagnosis codes. Now, once this claim has passed that initial scrub, Athena will submit this claim electronically to the payer. We'll perform claim follow-up when necessary. We know how long it typically takes for payers to pay on claims. So if there is a payer that's taking longer than they normally do, we, Athena, can initiate that claim follow-up. Now, once the payer pays on the claim, we, Athena, receive that remittance. So we are receiving remittance back into Athena. So we're able to do that posting work. So we are going to post back to the patient's account in the system. If there's any, if the EOB states that there's any patient responsibility, we would generate a statement and mail that out to the patient. All right. So let's go ahead and move on to reporting quickly here. In terms of reporting, we do have a robust report library where you can run reports in real time, or you can schedule what reports to run automatically. And you can also then assign the individuals who you may want to receive these reports. You just select those recipients and then you hit schedule. Now, you'll see the reports here just kind of broken out by category. All of these reports are exportable, so they export into a CSV or Excel file. You'll see the UDS report here, so they have its own tab or own area where you'll find all the UDS reporting. Outside of the report library, we do also have a report builder. The report builder will allow you to build any custom reports. We provide you with the resources and instructions on how to use this independently. We can also assist with this, but you can build as many reports as you'd like or as many reports as you need to. We do not charge anything additional for using the report builder. Now, we also do have an activity report. The activity report is going to look at those payments, adjustments, and how things are being posted. A very robust report here with tons of filters, so really you can build whatever report that you'd like. Using this activity report, what we'd like to do here is filter out by the G code. This will really will easily allow you to report on claims activity, including CMS CPS claims, and then also provide you with that visibility into how G or T codes are adjudicated and posted. So we'll see a couple examples of those here towards the bottom. And then last but not least, the quality management report. So we started this demonstration looking at the care gap work list. This corresponds with that really. But the quality management report allows you to filter by program or by measure. You can filter by places, service, or location, select specific providers. You can even filter by patient demographic and even insurance reporting category. This is going to produce a list of patients who either have or have not satisfied these different measures. Now, certainly you can take this list and act on it, right, by trying to encourage patients to come in. We do provide a group call campaign to send that outreach to those patients, encourage them and inform them how important this is to their health, to really make sure that they schedule that follow-up appointment with your center.